Here at my therapy centre, I've decided to do things a little differently and chosen how I want to treat patients for me personally that I find works best. Mostly we deal with joint-based problems, so we use techniques that would improve the movement of the spine. We use what we call adjustments, which are movements specifically at joint level to increase the movement of those joints. And we try and improve the movement of that joint, and certainly that's the key thing we do. We also do something called SOT, sacral occipital technique, and it works using these blocks as one of the primary treatment methods. And principle really is to improve the flow of the cerebral spinal fluid from the skull through the body down to the sacrum, which is the base of the spine here, and then back up. It's particularly good for people with long-term discal problems, with people with pelvises that move too much, hypermobile pelvises, quite common with females and pregnant ladies, but also quite common in gentlemen, surprisingly enough. It also provides a very gentle form of treatment, which a lot of people are looking for. I've also studied cranial, which is the sort of additional level of SOT. Cranial obviously works with the skull, and you can see here each colour is for a different bone. All of those bones move very slightly, but they do move, and displacement of the bones can give anything from headaches through to problems further down the spine. So a cranial physician will look quite often inside the mouth, and this is the palate area, and will work with that in order to affect the movement of the other skull bones. Very gently, obviously. Chiropractor has a lot of tools in their toolkit for treatments. We also do soft tissue work or massage, and we deal with trigger points which cause a lot of pain down and up the spine depending on what the problem is. This is called an activator, and this is used a lot with children and babies and with the elderly. You can alter the amount of push, so when you turn it down really low you get a little bit of push, and if I turn it up all the long way you can see how much my hand would move, and that's a really nice modality for people who are a little bit cautious of wanting to have adjustments, and you can really control that. Stretching and exercises are very useful for an area that's particularly stiff, and we would show and give exercises to a patient if we want to get an area moving. We'd also look at their lifestyle, so how they sit, their posture at their computer or their desk, how they stand, look at their neck and see whether they have poor posture at their desk or they're sitting, and also how they sleep. And that combined with the lifestyle changes and the treatment we'll do will give a specific package of care for that patient depending on what they need.